We aim to make knowledge spread very easy. And in this agenda, what we want to do today is demonstrate how you can spread knowledge about safety and person-centered care. And the main thing is that if we can spread the knowledge worldwide, not top-down, but horizontally from all societies, then we can learn. So, for example, when I get to quality improvement programs, when I'm working in a country like Mozambique or in Ethiopia, I am learning as much as I am teaching. They teach me different ways of doing things. So there's south-north spread of knowledge, often reverse spread of knowledge, and I take that back to Ireland or the UK or to Australia when I'm there, or to Latin America when I visit there, and spreading knowledge. So the idea is spreading knowledge very rapidly, and this is what we really need to do in order to improve healthcare. So let's look at the importance of patient safety and quality right now. And I'm just going to look at, for example, the 6 domains of quality and safety, and we're going to look at each of these domains just in terms of COVID. So, for example, safety. What we learned in this pandemic is the often unpreparedness we had of protecting our own staff with PPE. We had not paid as much attention to it as we would have. Now, reverse knowledge. Countries that had previous experience of pandemics, such as this, were able to adapt much quicker. So countries like South Korea, Taiwan, Hong Kong, China, where they've had pandemics before, were able to respond much quicker than often countries that haven't had this kind of pandemics for a long time. And I think that was a rapid learning that we had to have. So, for example, countries that had Ebola 4 or 5 years ago, we in the upper income countries in Europe hadn't had that experience, and so had to learn very rapidly. So patient safety, which we call patient safety, is really about people safety, and I think that has really changed. Within the whole crisis, medication safety became even more important as new trials were done with drugs that we weren't sure were working. So these kind of issues have made patient safety and people safety a much wider thing, and that's why the WHO is going to have, as for the Patient Safety Day, they're going to concentrate on staff safety, on healthcare worker safety as a major theme. So I think that is one of the things we've learned. Let's look at people-centered care. Again, your question was, what do you think about it? And for the 8% who said maybe, the challenge we had now under COVID was, how do you manage highly infectious or highly infectious disease like COVID with patients? How do you still have dignity and compassion and allow people to die with dignity and compassion, often which was the case? There were to have burials that were with dignity and compassion. How do you manage the lockdown with compassion? I think that we are going to look back and think about many things that we would do differently if we had thought beforehand. And in this regard, we were one of the many organizations that worked with Plaintree International to look at some principles for how to manage people in this kind of situation. When we're talking about people-centered care, I'll also talk about looking after the psychological safety of our staff, the people who are working in these highly difficult conditions, sometimes not going home for many days, or being worried about infecting their families if they're dealing with highly infectious disease. These kind of issues were all brought to the fore in the last 3 or 4 months. And then there's the ethics, the decisions that have to be made, very difficult decisions of who to treat, who not to treat, and what to do. All of these are challenges that we are facing right now and have to be spread out. And as different countries are at different stages of the pandemic, so those who are now entering the more peak stages can learn from the ones who are just coming out of that. If I look at timeliness of care, I'll just use the example we have in many countries of test and trace. And this is one in which countries that have got strong public health traditions, because they are testing and tracing for tuberculosis, etc. They could respond much quicker than countries that don't normally have these kind of infectious diseases. But when we're looking at timeliness, we also got to think about what about the people who have other conditions in healthcare who are not being treated. And these are the collateral damage that has come out from concentrating on one condition such as COVID, what has happened there, and the wait times for routine treatments, and also the excess outcomes for people who have got chronic diseases or cancers. These are things that we're going to look at going forward. I could look at the next two, the efficiency and effectiveness, is learning how we can do the right care. And that's where we've been working with the Italians to come up with recommendations very rapidly. That was simple. The learning that they had was initially, it was very complicated, and we had to simplify for the front line to know what they should do. And I think this is something we could learn from each other. The efficiency, of course, the scarce resources and developing new processes. My feedback from many of the people I've been working with is that those who've had training in human factors found it much easier to develop better new resources and new processes than those who hadn't. And then lastly, the equity, which probably is the most important of all, because this is all about person-centered care. How are we ensuring that people are treated equally? Now, I've just been reviewing a paper on social determinants of health and COVID infection. And in most countries, people who are poorer, people who have chronic disease, and people from ethnic minorities have had a worse outcome. And there are many reasons for this, but the social determinants of health and equity are really essential. And I think that one of the big lessons we're going to have right now on quality and safety is using the lens of the social determinants of health to look at how we provide quality and safety going forward. And I really would want to stress that as one of the major issues that we'll need to look at. We'd also need to look at how we could have, and as a pediatrician, is equity of outcome for some of the interventions. So, for example, if you go into lockdown, the essential workers, the people who couldn't go into lockdown or work from home, are often the poor. The people who couldn't look after their children were the poor, and so the children would not get education if their parents couldn't really provide it at home because of their work situations. So these 6 domains became even more important over the last 3 to 4 months, and will grow in importance as we go forward. And one of the reasons that we really want to look at it is to make sure that we pay attention to these 6 domains. And I'll add another domain, and that of the environment. One of the benefits of the COVID is that there's been less travel and so less pollution, and the environment has in some ways benefits, but we have to really look at the impact of climate change.